Which of the following is a primary indication for using a left ventricular assist device, LVAD? A. Acute coronary syndrome with stable hemodynamics. B. Chronic, end-stage heart failure with low ejection fraction. C. Uncontrolled hypertension despite medication. D. Mild, intermittent arrhythmias. Answer: B. Chronic, end-stage heart failure with low ejection fraction. Explanation: LVADs are primarily indicated for patients with chronic, end-stage heart failure who have a low ejection fraction and are not candidates for a heart transplant. These patients typically experience severe symptoms despite optimal medical therapy, and the LVAD helps provide circulatory support until a heart transplant is available or other treatments can be pursued. Which of the following is a key contraindication to the use of ECMO, extracorporeal membrane oxygenation, for a patient in cardiogenic shock? A. Severe coagulopathy. B. Acute myocardial infarction. C. Uncontrolled arrhythmias. D. Severe hypothermia. Answer: A. Severe coagulopathy. Explanation: Severe coagulopathy is a contraindication for ECMO because the therapy involves the use of anticoagulation, which would significantly increase the risk of bleeding. In patients receiving mechanical circulatory support, which of the following would be the most common cause of hemolysis? A. Uncontrolled hypertension. B. Inadequate anticoagulation. C. Pump malfunction or inappropriate speed settings. D. Renal failure. Answer: C. Pump malfunction or inappropriate speed settings. Explanation: Hemolysis is commonly caused by mechanical stress on red blood cells, especially in patients with mechanical circulatory devices such as LVADs or ECMO. This can occur if the pump is malfunctioning or the speed is not appropriately set, resulting in shear forces that break down red blood cells. Which of the following complications is most likely to occur in patients with long-term use of a left ventricular assist device, LVAD? A. Gastrointestinal bleeding. B. Aortic valve regurgitation. C. Right heart failure. D. Pulmonary embolism. Answer: C. Right heart failure. Explanation: In long-term LVAD use, right heart failure is a common complication, particularly because the LVAD primarily supports the left ventricle. If the right ventricle is not functioning optimally, it can lead to volume overload, causing symptoms of right heart failure. Close monitoring and management of right ventricular function are crucial in these patients. Which of the following is a common risk factor for the development of pump thrombosis in patients with LVADs? A. High serum potassium levels. B. Suboptimal anticoagulation therapy. C. Lack of exercise and mobility. D. Hypertension. Answer: B. Suboptimal anticoagulation therapy. Explanation: Suboptimal anticoagulation therapy is a significant risk factor for pump thrombosis in LVAD patients. Inadequate anticoagulation can lead to the formation of clots within the LVAD, which may impair its function and lead to complications like stroke or device failure. Maintaining the correct level of anticoagulation is crucial to prevent this risk. What is the most appropriate management strategy for patients with an intra-aortic balloon pump, IABP, who develop severe hypotension and reduced cardiac output? A. Decrease the balloon inflation pressure. B. Increase the inflation rate of the balloon. C. Assess and optimize the patient's fluid status. D. Administer vasopressors immediately. Answer: C. Assess and optimize the patient's fluid status. Explanation: Severe hypotension and reduced cardiac output in IABP patients often indicate inadequate perfusion or fluid imbalance. Optimizing fluid status through appropriate administration of fluids or blood products is crucial before making further adjustments to the IABP or using vasopressors. The IABP can help with afterload reduction, but proper fluid management is often the first step in improving hemodynamics. Which of the following describes the typical role of ECMO in patients with severe respiratory failure? A. To completely replace lung function permanently. B. To provide circulatory support without addressing oxygenation. C. To oxygenate the blood and remove carbon dioxide temporarily. D. To increase blood pressure in hypovolemic shock. Answer: C. To oxygenate the blood and remove carbon dioxide temporarily. Explanation: ECMO is used in patients with severe respiratory failure to temporarily support the heart and lungs by oxygenating the blood and removing carbon dioxide. This provides time for the patient's lungs to heal or for other interventions to be pursued. It is not intended to permanently replace lung function. Which of the following is the most important consideration in the management of a patient on ECMO with suspected pump thrombosis? A. Replacing the ECMO circuit immediately. B. Adjusting the anticoagulation therapy. C. Increasing the ECMO flow rate. D. Starting broad-spectrum antibiotics. Answer: B. Adjusting the anticoagulation therapy. Explanation: The first step in managing suspected pump thrombosis in ECMO patients is adjusting anticoagulation therapy. This is typically done by increasing the anticoagulation level to prevent further clot formation. If pump thrombosis is confirmed, additional interventions, such as replacing the circuit or performing thrombolysis, may be necessary. What is a major disadvantage of using a pulsatile pump system in a left ventricular assist device, LVAD? A. Higher risk of device infection. B. Increased device complexity and size. C. Lack of compatibility with anticoagulation therapy. D. Inability to provide adequate flow during low cardiac output states. Answer: B. Increased device complexity and size. Explanation: Pulsatile pumps are more complex and larger than non-pulsatile pumps. While they mimic the natural pulsing action of the heart, which can be beneficial for certain physiological processes, their increased complexity and size often make them more difficult to manage and less ideal for long-term use compared to centrifugal pumps. Which of the following is the most common long-term complication for patients with a total artificial heart, TAH? A. Hemorrhagic stroke. B. Infection. C. Pump malfunction. D. Rejection of the artificial heart. Answer: B. Infection. Explanation: Infection is the most common long-term complication for patients with a total artificial heart, TAH, particularly infections related to the driveline, which connects the external power source to the implanted device. Managing infection risks and maintaining the sterile integrity of the device are key components of care for these patients.